Hello, this is Dr. Emma Hitt-Nichols, and this is the information on the latest U.S. FDA approvals the week of December 2nd through December 8th, 2023. The FDA has approved Iptacopan, that's also called Fabhalta, as the first oral monotherapy for the treatment of adults with paroxysmal nocturnal hemoglobinuria, or PNH. Iptacopan is a factor B inhibitor that works on the alternative complement pathway of the immune system, controlling red blood cell destruction within and outside the blood vessels. People with PNH have an acquired mutation making red blood cells susceptible to premature destruction by the complement system. PNH is characterized by hemolysis, bone marrow failure, and thrombosis in varying combinations and levels of severity. The approval is based on data from the APPLY-PNH phase 3 trial, which is conducted in adults with PNH and anemia despite prior anti-C5 treatment, and is also supported by data from the APPOINT-PNH study in complement inhibitor naive patients. In the APPLY-PNH trial, treatment with Iptacopan increased hemoglobin levels without blood transfusion in most patients. The approval of Iptacopan was granted to Novartis. Also this week, the FDA has approved 2 cell-based gene therapies for the treatment of sickle cell disease. One therapy has the brand name Casgevy, and that's also called hexagamglogene autotemcel. And the other is Lyfgenia, which is also called lovotibeglogene autotemcel. Because of the complexity of these names, I will refer to them with their brand names, Casgevy and Lyfgenia. Casgevy is the first FDA-approved therapy utilizing CRISPR-Cas9, which is a genome editing technology that earned its founders the Nobel Prize in 2020. Casgevy is intended for one-time administration via a hematopoietic stem cell transplant, where the patient's own cells are modified so that fetal hemoglobin production is increased. In a trial of 31 patients with sufficient follow-up time to be evaluable, 29 or 93.5% achieved freedom from episodes of severe vaso-occlusive crises for at least 12 consecutive months. The other therapy approved this week, Lyfgenia, works by permanently adding a functional beta-globin gene to patients' own hematopoietic stem cells through lentiviral vector gene addition therapy. Lyfgenia's approval is based on data from the phase 1/2 HGB-206 study. In a study of 32 patients, severe vaso-occlusive events were resolved in 30 patients, or 94%. In addition, 28 of the patients, that's 88.2%, experienced no vaso-occlusive events at all. The approval of Casgevy was granted to Vertex Pharmaceuticals, Inc., and the approval of Lyfgenia was granted to Bluebird Bio, Inc. Also this week, the FDA has granted Fast Track designation to SGT-003, a gene therapy being investigated for the treatment of Duchenne muscular dystrophy, or DMD. SGT-003 uses a novel caspid adeno-associated virus, SLB101, to deliver a shortened form of the dystrophin protein, microdystrophin, which is compromised in DMD. DMD affects approximately 6 in 100,000 individuals across Europe and North America and is associated with progressive muscle weakness. The manufacturer of SGT-003, Solid Biosciences, is initiating a phase 1/2 trial. SGT-003 will be administered as a one-time intravenous infusion. Long-term safety and efficacy will be evaluated for a total of 5 years following treatment. In June of this year, the FDA granted accelerated approval to Sarepta Therapeutics Elevatus, which was the first gene therapy for DMD. And now a message from the supporter of this podcast, Nascent Medical. Our native English-speaking MD and PhD level medical writers are dedicated to delivering top-quality writing anytime you need it. Whether you require rapid turnaround needs assessments, medical news pieces, manuscripts, slide decks, or ad board summaries, or more, NascentMC.com has you covered. Nascent Medical, because you should never have to be without excellent medical writing assistance. Also this week, the FDA has granted 510(k) clearance to a novel blood collection device that obtains blood samples from a finger stick and produces lab quality results for some of the most commonly ordered blood tests. According to a press release from the manufacturer Becton Dickinson, the mini drawer capillary blood collection system is less invasive than a traditional venous drawer because blood is collected from a patient's finger by a trained healthcare worker without the need for a phlebotomist to collect blood from a vein. According to the manufacturer, the procedure has the potential to transform diagnostic testing. The 510(k) clearance includes low-volume blood collection for a lipid panel, selected chemistry test, and hemoglobin and hematocrit testing. All right, that's it for this week. Have a wonderful week, and please do tell your colleagues about this podcast and trying to grow it. It's a few, episodes 29 or 30, still trying to grow it. So I hope you will tell your colleagues if you find this helpful. Thanks so much. Have a great week.